Our hybridized surgical and catheter-based approach to atrial fibrillation ablation is a procedure where half of the procedure is done by our cardiac surgeon in the operating room, and the remainder of the procedure is completed by myself in our electrophysiology suite. That procedure is an option for patients who have had atrial fibrillation for a long time. It's an option for patients who have had prior catheter ablation procedures which may not have worked. And it's also an option for patients who have the chamber enlargement that makes catheter ablation very difficult to do alone. So when we're considering patients for the hybridized atrial fibrillation ablation procedure, we're incorporating many different features of that patient into our decision. Another thing we do is before ever scheduling the procedure, we have the patient meet both with myself, representing the electrophysiology team, and with Dr. Patel, representing the cardiothoracic surgical team, so that all of their questions and concerns can be addressed prior to scheduling the procedure. If after meeting with both myself and the surgeon, the patient feels comfortable proceeding with the procedure, then we proceed down that road.
It's a procedure that we do through a small incision. In fact, it's in the belly that we make the incision, but access the heart through the diaphragm and on the back side of the heart. And that allows the surgeon to create the scars on the heart to treat atrial fibrillation. But then it's combined with the electrophysiologist who we work closely with to provide the most complete scars that we can and maximize the outcomes. The nice thing about that approach is it combines two experts to provide the most we can in terms of treatment of this atrial fibrillation, and do through a very, very small incision. So the recoveries are going to be much faster and patients returning back to their normal lives.